one of the topics that our listeners we would love to hear is the concept of zoonotic dimension. Particularly, these are the diseases that we know can jump from animals to human. And in the context of Namibia, particularly livestock diseases or vectors, for example, ticks, because we know that they can cause Congo hemorrhage fever. How does vaccine animal integration sort of reduces the risk to infection to public health, or let's say infections to humans?
Okay, thank you for that. That's a quite important question. Even though most diseases that we treat don't directly jump from animals to humans, they do spill over to humans, especially in terms of vector transmission. So our job as veterinary practitioners is that we are at the interface of actually ending this, and that we do not allow this to spill over to the human population. So say your control of vectors or vaccinations, that means less pathogens. So less pathogens, then obviously in the environment, then obviously there's less pillage of this to the human populations as well. So that's, and also just integrating the One Health approach, that the environment, humans and animals as well are integrated together, but obviously managing infections in animal populations. So your control of vectors and your vaccinations are quite beneficial to human health subsequently, because like I said, less pathogens, less spillage over to the human population.
Okay, I think we understand that. But I think one interested question is, like, we know that there are some animals in the Namibian context that we say they are economically important. You, as according to your experience, is there a particular distinctions between those that we are saying that there's a particular economic importance attributed to it compared to those ones that they have? What is the response, especially in terms of vaccinating those particular animals that are not economically important? Is the status quo, is it the same as those that are economically important, especially in our communities?
Okay, so yes, so you have, say, diseases like, say, for instance, your FMD. We practice vaccination, but not necessarily to combat zoonosis, because it's not a zoonotic disease, but it is a disease of economic importance. So it results in huge livestock losses. So it's and that, it affects trade and all of that. So it's quite a disease of economic importance. And then, for instance, you have your diseases like, say, rabies that can be transmitted to humans. So that is something that you'd want to combat zoonosis. And in terms of importance of vaccinations, I'd say they're equally important, and they should equally be carried out. We shouldn't really make a distinction that this is, because in the end it affects, and like I said, less pathogens in the environment and less spillage of these infections as well.
Yes. Okay, I think to add up on you, quoting from you, less pathogen, less spillage. We've often heard about building herd immunity in livestock. Can you please tell us, what does it mean to herd immunity in livestock, particularly to our farmers and communal farmers, and what are some of the challenges that you face in achieving this particular concept?
Okay, so herd immunity, herd health immunity, is basically when at least 70% of your herd is vaccinated against a particular disease. So one of the challenges that we mainly face is, I think, awareness. Farmers are not quite sure, are not quite aware that there is such a thing as herd immunity, and it's quite important to carry out vaccination, because herd immunity, what it helps is, it helps in the stoppage or the hindrance of this spread of this disease amongst a herd, and obviously then between herds as well, eventually, subsequently. So that's why it's quite very important. And like I said, awareness, and then you have issues like access to the necessary vaccines. Veterinary sciences is a remote science, so remote access to veterinary services as well. So these are some of the challenges that we face in attaining herd immunity. And also, some farmers may acquire these vaccines, they may have them, but the ways in which these vaccinations are supposed to be carried out. The route of vaccination, the timely vaccination, at the time when animals are supposed to be vaccinated or against a particular disease, and follow-up subsequent vaccinations, boosters and all of this. So these are some of the challenges. And also storage, cold chain, you know, you acquire a vaccine and then it's not properly stored, so then that renders it ineffective. So these are some of the challenges we inquire.
Okay. One question with regards to that. We now want to attain this 70%, you know, rate. Whose responsibility is it? Is it the Ministry of Agriculture to go out in the communities and say, we have this particular disease at this season and you want to vaccinate? Or is it the farmer who must buy the medication or the vaccines, store them, and then administer them to the animals by themselves?
Okay, so usually these vaccines are available at retailer outlets, and farmers usually should go out there and acquire these vaccines, and then obviously vaccinate against now these the said diseases. But fortunately, we are at the disposal of these farmers, so they are always welcome to reach out and approach veterinary officers for awareness, how to vaccinate, when to vaccinate, what to vaccinate against. It is also our mandate as the Directorate of Veterinary Services to go out into communities and engage farmers, educate them on what to vaccinate against at what particular time. So it's at the juncture of all of this, I think we meet both the officials and the farmers.
Okay, that is particularly great to hear. And when we talk about this herding immunity, I think what we can attach to it is success stories. And can you please tell us, especially in the Namibian context, when it comes, what are some of the success stories that we can talk about when it comes to vaccination that have made tangible difference? Particularly, we have heard of rabies control and how people have gone into the communities. And what can farmers, the veterinarians, and the broader community, what can we do, or what have we learned from this that we can impose or imply to the next, initiative that we may have?
Okay. So I'm not quite sure if you've heard about the National Dog Campaign program against rabies. That is one of, I think, the biggest success stories in terms of vaccination programs. So what we've done is it runs across the country annually, vigorously, I'd like to say, where we vaccinate dog populations, and we go out into the communities with vaccines. We vaccinate. We do school outreach programs where we educate school children on how to care for their pet populations, and also just educate them on the nature of the disease of what rabies is, and what to do when you encounter it, or when you're bitten by a dog, for instance. So it's been quite a very successful program, I'd like to say. And since the start of this program, we've actually been experiencing very low positive rabies cases, which is obviously what the aim is, to achieve zero rabies eventually.
Okay. I think we are attaching this success story to the vaccine and what vaccines can do.